Thank you. Welcome everybody. We can start the webinar. I'm Victoria Jimenez. I'm Head of Sector for Urban Development at the Union for the Mediterranean. I will be moderating this webinar together with Sinaya Netanyahu. Sinaya, that is Program Manager for Environment and Health Impact Assessment at the WHO European Center for Environment and Health. I will be giving her the floor just in 2 minutes for her welcoming speech. This is the third webinar that WHO Regional Office for Europe and the UfM, the third webinar that we have organized. And in this occasion, the title of the webinar is Protecting Environments and Health by Building Urban Resilience. So we choose this topic because climate change, inadequate urbanization patterns, and environmental degradation have left many cities vulnerable to disasters, as we will have the occasion to see later. Disasters such as extreme weather events, floods, earthquakes. In fact, the picture that we have in our invitation for this webinar was Izmir, and we will have the occasion to have a presentation from Izmir on how they react to this earthquake. Thing is that much can be done at the city level by local authorities, planners and managers to apply urban planning and design as an instrument to reduce risk and vulnerabilities and build resilience. And that's why this webinar aims to reflect on potential actions that can be taken by national and local governments to establish and support preparedness and resilience at local scale. So, you can choose, we have had the video, in any case, you can choose the language in which you would like to follow the webinar. Languages available are English, French, and Arabic. And then during the question and answers time, also you are free to pose your questions, well, preferably in English or French, but we will try to manage if you do so in Arabic. It will be 1 hour and a half webinar. We will have a lecture of 20 minutes by Matthias Brauchbach, Technical Officer for Urban Health and Equity at WHO European Center for Environment and Health. And after this 20 minutes presentation, we will have a panel discussion where we will have the occasion to have presentations from several local authorities and researchers. And then hopefully we will have approximately 20 minutes time for question and answers, so reactions from the audience. And with this, I give the floor directly to Sinaya for the welcoming speeches on behalf of WHO.
Thank you very much, Victoria, and thank you so much for the cooperation between WHO and the Union for the Mediterranean. So, ladies and gentlemen, distinguished participants, I would like to welcome you to this WHO-UfM joint webinar on protecting environments and health by building urban resilience. This is a very important topic for cities and for public health. Core determinants of health may be affected globally by emergencies such as pandemics, environmental factors such as climate change and pollution, also social factors such as inequalities or national health systems and policies. However, the main impact on health tends to take place at local level, where people live, where people work, travel, socialize, or seek care and support services. This is why our attention today is for cities. Local infrastructures and services are critical for health and well-being, but during disasters and urban extreme events, local conditions and services are challenged and may have no or only a restricted functionality to provide healthy and sustainable environments. Urbanizations, environmental degradation, and demographic change have increased our vulnerability to environmental and climate disasters, affecting millions of people across the globe every year. Climate change and environmental pressures have increased our vulnerability to disaster globally, but also locally. In the last 2 decades, flooding and storm events have strongly increased, causing more than 300 deaths globally. Further, local emergencies are triggered by industrial accidents, technological disasters, and system failures, showing our dependence on modern technology. In Europe alone, the estimated economic loss due to disasters amounts to $271 billion over the last 2 decades. In the aftermath of COVID-19, major investments are being made across the European region to revive the economy and reduce the inequalities that have been increased by the drastic response to the pandemic. This is, by the way, true not just for the European region, but also globally. Cities are the place where major opportunities exist to this reconstruction, to deliver multiple societal gains, as well as environmental benefits. It is at the local level, in urban setting, where action is needed to learn from the past and ensure resilience and healthy conditions for our communities. Increasing preparedness for emergencies and their related health impacts should therefore be considered a priority by national governments and local authorities. This is why city networks and local authorities, and also the national networks striving for health and sustainable development, have a fundamental role to play for health promotion and health security. Today, we hope to hear some examples of good practice on that challenge. This also connects with our WHO European Programme of Work for 2020-2025, which defines also the need to protect against health emergency and also to establish local living environment and promoting health and well-being. Those are core priorities for us in WHO. We need to urge national governments to learn from the past and better prevent, to prepare for local disasters and better protect local citizens. Better and healthier cities require bold decisions by both national and local governments. Such investments not only likely result in improved local sustainability and higher quality of life of our people, but will also reduce the demands on national health care systems and in turn also contributing to their resilience. So thank you for joining, and I wish us all productive and exchange and discussion. Thank you. Back to you, Victoria.
Thank you, Sinaya. Well, so now we pass to the lecture that Matthias Braubach, for the technical, he is technical officer on urban health and equity at WHO European Center for Environment and Health. And Matthias will be giving a speech or an intervention on health relevance and planning actions for better preparedness and resilience. So Matthias.
Thank you very much, Victoria. I am on one screen, so I cannot exactly see well when I'm putting the presentation mode, but I hope you can see it now.
We can see it, yes.
Okay, perfect. And you can hear me well?
Yes.
All right. Thank you very much for the introduction. And welcome, ladies and gentlemen, and all participants to this webinar. Thank you for joining. We're going to start the webinar with an introduction and an overview of a project that WHO European Center for Environment and Health in Bonn has recently finished and published this summer. The focus is on the urban planning for resilience and how it affects health. So I want to summarize the key messages and the lessons learned from that project, and I hope that this will contribute or start the discussion and introduce nicely some of the local examples that we're going to hear. So going right into the agenda, I'm going to quickly present the objectives of the 3 technical reports that have been developed in the project on urban planning, resilience, and health. And then I will focus on the summary report that is putting all the key messages together in one shorter document for technical planners, for decision makers at local level, and will present the different action areas that have resulted from the whole project and the 3 reports. What are the practical elements that can be implemented under the 3 action areas at local scale? And then I will conclude with the 3 key messages for policymaking and 3 key messages for urban planning that have been coming out of the project. So the first technical report was an evidence review on the urban planning, design and management approaches to building resilience. The aim was to explore how local level urban planning, management and design interventions can contribute to improve the preparedness and the resilience building at local level. The review looked at 172 academic papers and also looked into the findings and the themes of 12 reports by multilateral institutions like the EEA, WHO, UN organizations, and so on. Roughly, the key elements covered in these papers largely related to climate change as a key hazard, but also they look cross-cutting at methods and approaches. And a lot of these papers, almost 30%, looked into multi-hazard thinking, not only looking into one threat, but various threats that affect the local level. The second report that was done for the project was to review case studies and to see the local experiences on how to build resilience. The aim was to collect lessons learned on the practical challenges that cities experience during a crisis situation, and to see what did they propose or implement locally, what actions, policies, interventions were done to foster and improve local preparedness and urban resilience. We collected case studies from 12 cities across Europe, all of which had a different urban crisis and disaster experience, except 2 cities in Utrecht and Helsinki, which we used kind of as a control group to see what type of actions were done in cities that did not experience a major disaster in the last decade. The last technical report for the project was a review of indicator frameworks that can support urban planning for resilience and health. The main objective was to analyze what these indicator frameworks cover and how relevant and applicable these indicator frameworks are for the support to resilient and healthy cities. And as you can see on the slide, we have been reviewing jointly with UN Habitat for that technical report 6 frameworks from an international to a very local scale to see how they could contribute and support urban resilience. All these 3 reports have been coming together and have been compiled and summarized in the key message report, the summary of the project on urban planning for resilience and health. And I'm going to focus now for the next slides on this summary report and provide the key messages that came out of the whole project. If you want to have more details, you can go back to the technical reports that I presented before. They are available on the website. So going into the key messages of the project, we have identified various action areas for building local resilience. This has been coming from the knowledge compiled by all the 3 reports. And what was compiled as the major action areas that can support local resilience are basically categorized in 3 areas. The more yellowish colors represent action area A, and they relate to the administrative and the organizational processes, how municipalities operate, how they function, how the processes flow. The second action area identified as important related to tools, indicators, and frameworks. This is about how we compile knowledge, how we manage the knowledge, and how we interpret the knowledge. And the third action area is the core element of urban resilience. It's about the spatial planning in the city, what interventions, what actions are done, and based on the material compiled, this was broken down into land use and building regulations, active mobility, green space and nature, and the proximity lifestyle. I'm going to go a little bit more in detail later on. So these are the main action areas, A, B, and C, looking at the different elements that are needed to shape local resilience. The summary report looks in more detail into these action areas and identifies for the different areas in this action, what type of actions are possible or helpful and relevant in this area. So you can see, for example, here in this administrative and organizational processes in this action area, we have different elements that have been, just to give an example, identified. I cannot, because of my screen now at the moment, identify the first one because I have a Zoom window over it. Let me just go back. So the first one I cannot read myself because the Zoom sign is over it, but the second one on institutional capacity, one of the things that we identified from various cities, that it is extremely important to define the priorities and the common visions across sectors, departments, but also different levels of government. Who is responsible for what in a crisis situation? Who is taking the lead on what, who has what information, who takes a control on a certain action, on a certain sector, on a certain service that needs to be reconnected or rebuilt. To be clear in a disaster situation, who is doing what is essential. And the lesson learned from many cities was that don't find out who should do what when the crisis is there, fix that before. So that was a very powerful message that we learned from many. And it's one of the most important one under institutional capacity when it comes to the organizational processes. The next area on tools, indicators, and frameworks also has the three different areas of work that should be considered at local level. And I would just like to highlight this one here. It's extremely important to consider the potential cascading effects that come from emergencies and to identify the critical infrastructure that needs to be kept functional during an emergency. Because if the energy support is failing, a lot of other emergency services and public services will fall out. So there will be new crises developing based on the energy cut. If water supply is failing, it can also create certain issues that will certainly become visible and a problem at least 1-2 years later, if not immediately. So these all will have consequences and shape other areas where interventions are needed. And to be clear about the connections, the vulnerabilities of the system, to know when this happens, we need to immediately think about other things that could happen as well, because they are connected, is very important, and that should be mapped at local level before these interdependencies and vulnerabilities to be prepared and immediately go to action. The last action area on the spatial planning, design, and management has the 4 different elements that I introduced before. And also here, I would like to highlight quickly, it's extremely important to look at planning in a preventative way to reduce risk exposures, using buffer zones, risk maps to know what risks are where in the city, and to not build critical infrastructure in that area, to not put housing and residential areas in that place, because you know that there might be a higher vulnerability, a higher risk. And being aware of this and implement this knowledge in planning is fundamental to avoid that when a disaster strikes, there is huge consequences on the population and on the public services. A second element I want to highlight is that nature-based solutions and the use of nature came out very strongly from the city side. And they, for example, one example of many, have been very helpful to manage surface water and avoid the risk of flooding by different nature-based solutions that manage the flow and the presence of water when there's too much rain or flooding. This can help a lot, and that was highlighted in many places. So these are just some examples to show how the summary report tries to provide key messages on what at local level can be done given the different action areas that are available to mitigate, prepare, and become more resilient for crisis. And with this, I would like to move on to the 6 major key messages that we have identified. The first 3 messages are very much looking into policy making. And the first one is that policy making should use relevant data and tools to enhance risk-informed decisions and address inequality. This is one of the key messages where City said we need to do more on this, and it's also a lesson learned when a disaster strikes, that we need to be better prepared and have these data, because then it's too late to collect the data on where vulnerable people are, where a water system is getting the water from. If you don't know that in the beginning, it's too late to find out. So it's important. There's more key messages in the summary report. I'm just selecting a few of the important ones to highlight as an example. It's very important to invest in data collection and management prospectively, and not when you need the data. You need to have the data available when you need them. To establish indicator frameworks and assessment tools, and it's one of the key messages from many cities, extremely important to include vulnerable groups. There's a lot of equity issues that come up when a disaster, an emergency situation is taking place. And it's important to know before where are certain vulnerable people, where do we need to act first, which people are most exposed and most endangered. And also it's important to apply urban and land use planning based on risk data. As I mentioned before, from a policy level, it's important to identify the risk areas and prevent certain functions or prevent any functions in that area, depending on the risk profile. So that should be considered in planning and policy making as well. And then the summary report identifies for the 3 different action areas that I described before, which of the actions can be taken to support this key message on policy making, data and tools for each of the different areas. So everybody interested can take here some information on how can I strengthen my local response on policy making. The second key message relates to policy making to use community involvement and engagement in urban interventions. This was also raised by many cities and also in the evidence review. And it's not always a part of the indicator frameworks. So there is a need to establish a participatory planning to be more transparent and have a long-term accountability of the local governments to really work towards urban resilience and to check with the community, where are your risks, where are your fears, or what do we need to work on to make you safe. It's important to provide open access to relevant data and indicators, so it's not only accessible to the local authorities, but also to NGOs, to the public, maybe to local universities and research centers. It should be shared and transparent. And it's also a lesson learned that international agendas on urban resilience, urban health, healthy cities, there's a lot of different ones, should be considered and to commit at local level to comply with these international goals, to localize them and to use them to set the common goals for the city on what should be achieved. There's a lot of guidance that can be taken from there and to be broken down for application at local scale. And again, we have a set of key messages that would help to support this key message and its implementation. The last key message for the policymakers would be to apply institutional innovation by breaking down silos and establishing common goals. We have also seen in many of the cities, it comes out also from the indicator review and the evidence review, that too often different departments work in isolation, and especially in an emergency situation, this very much has restrictions and limitations. What was clearly coming out of the project was that it's important to have a whole of government approach to emergency management and preparedness. One sector can maybe solve one technical issue, but an emergency has different levels and different components, and it can only be solved together. And as mentioned before, there's a lot of interdependencies between different sectors, services, and infrastructure. So this cannot be handled in isolation. It needs to be handled jointly, and it needs communication and collaboration across the sectors. Therefore, it's important to improve the intersectoral and cross-level communication at the local governments and also to the higher governments at regional and national level, which might have to support an emergency case. And this is something that should be planned and exercised in advance. And finally, it's also coming back to the comment earlier on the roles, who's responsible for that. It's important to set up a clear leadership structure and clarify the roles and responsibilities. During an emergency situation, it's too late to think about who's doing what. There should be plans and clear structures made in advance, and cities that had that in place seem to be managing situations better. And again, we have a set of action elements that would support that key message. Moving to the key messages for the urban planners. Urban planning should establish and implement planning and regulations with a preventative approach to protect health. I mentioned before, there are ways to include risk into land use planning by using buffer zones and really think about siting of critical infrastructure, what goes where, and it's probably even more important to say what does not go to a certain place. One important element is improved building regulations that can improve structural resistance, especially for critical infrastructure. And infrastructure design should account for future predictions, especially for climate change. If we're building now buildings that will be staying for 100 years, we need to take into consideration climate perspectives of the future and not of today. and try to avoid by infrastructure and design cascading effects by having more flexible and resilient systems for services at local level. Again, a set of key message of actions that can support implementing that key message. And then another key message was that urban planning should promote more healthy and equitable proximity lifestyles and reduce dependencies. What this means is that at the moment, people need to use a lot of places in the city to cover their daily needs, to go shopping, to go to work. We have a huge action area where we move across the city. And in situations of emergencies, and we've also seen that during the pandemic, it's very difficult when there's lockdowns and people cannot move and travel. And there might be other situations, energy outage, flooding, earthquake, that would not make you use the whole city because you simply can't. So it's important to design and develop compact cities, to have a land use mix and connectivity throughout the city. So it is easy to move around. People are maybe independent. They don't need public services or cars or buses. They can maybe do it by walking on short distances, by traveling by bike, to be independent from any public service that might potentially fail, and to have all the resources close by the services to cover daily needs that reduce dependencies, because you don't need to go to the other part of the city to cover your daily needs, to go shopping or to bring kids to school. It should be close by, and that will make a lot of things easier in an emergency situation. Again, we have a set of action elements that would support implementing that key message. The final key message is that urban planning should use green and blue spaces in a strategic way and synergistically, putting these things together as a framework to build resilience. We have seen that urban green and blue infrastructure contributes a lot to urban resilience, be it the mitigation of heat waves, water management, but also providing social space and also a good environmental quality. We've seen that nature-based solutions can be applied at local and also city and regional scale. So it has a lot of different areas where it can be used. And again, here, notice was taken that often it's important, it's forgotten to put this especially on the disadvantaged areas that are under-serviced by nature and therefore need more of that. And it can also help to make them a bit more resilient. Finally, again, we have the action elements that can be used for implementing that key message. So as a conclusion, you will find all that information and more in the key message summary report. You can see more technical details in the 3 technical reports of the project, and I hope they will be useful. The conclusion from our side was that a lot of these things that came out of this project are not brand new and innovative in a way like we have never heard that before. A lot of this simply makes sense. It's part of a sustainable and healthy city planning. And a lot of this will contribute to have a resilient city. And thinking specifically about resilience will also make cities become more sustainable and healthy. So at the end of the day, this is one agenda. This is one complex that has different city perspectives and city plans coming together. It is not a completely new way of planning cities. It is, I would say, a more aware and reflected and risk-sensitive way of planning and managing cities, and that would do justice to all of the major goals that cities would have: to become sustainable, to become healthy, and to become resilient. With this, I would like to thank all the contributors to the project, IS Global, UN Habitat, the peer reviewers, and also the city representatives that contributed to the city case studies. And for more information, please let us know and join the discussion later on. Thank you very much.
To the panel discussion, it will be a 40 minutes panel discussion led by Sinaya. We will have the opportunity to hear from 4 panelists, and I directly pass the floor to Sinaya to lead that part.
Thank you very much, Victoria, and thank you very much, Matthias, for a great presentation. We would like to start now our discussion, and we have with us a panel where there are 2 city representatives from Portugal and Turkey. We have also a representative from a ministry in Tunisia, and also a representative of the International Society for Urban Health. And the purpose of the panel discussion is to learn more about local experience and action related to urban resilience. I like to remind also the speakers, the participants, that you can feel free and introduce your questions or comments through the chat. We also posted in the chat a link to the 4 documents, the 4 reports that Matthias was very kind to summarize and describe. So I would like to start with our distinguished panelist from Izmir, from the municipality of Izmir, Mr. Merkan Arselan, from the Department of Earthquake Risk Management and Urban Improvement. So you are at the municipality of Izmir in Turkey, and Izmir has experienced a major earthquake in 2020 with more than 100 fatalities. And I'd like to ask you, how did the earthquake affect the critical infrastructure such as energy and water supply and also the health system services? And what was the biggest risk to health in the days after the earthquake? So if you can take about 3 minutes, and then I will have another question to you, and then I will go, we will go to the next speaker. So the floor is yours, Mr. Rossan.
Okay. Am I starting with answering your questions or any presentations that I should share with you?
It will be great if you can answer the questions. We didn't plan for a presentation, so just
Okay.
we'd like to know more about, you know, the biggest risk for health in the days after the earthquake, and also what infrastructure such as energy, water supply, and health system. What happened to those critical?
We have experienced a large earthquake on 30th of October 2020, and it was a magnitude of 6.9. We have several damaged structures, but most of them are the residential buildings, which are 30 years old and older than that. For the critical structures such as government buildings, hospitals, or water supply services, we do not have any severe damage for the hospitals or energy lines or water supplies, but we have a serious damage on the municipality building and some of the local government buildings. So we, because the damage was too large, the municipality building of Izmir has been started to demolish right now. Most of the building is gone at the moment, and we work somewhere else because of that, and we plan to build a new one. So that was the biggest damage for the city, for the local government here. But we do not have severe damage for the health services or any energy or water supply.
Well, thank you. But in general, I mean, you did mention it that there was a destruction of public infrastructure like the municipality, but it can also be destruction of residential buildings that probably have been built for decades, and it's probably not easy for a large city to have an earthquake-proof city, and it's impossible also to prevent potential infrastructure failures for the future. But following this incident in 2020, can you describe for us what were the short-term and the long-term urban planning management measures for the city?
Okay, for the quick action for the citizens which lives in the disaster area, some of the buildings have already been collapsed by earthquake, and then they start to empty the damaged buildings. Then they collapse all the damaged buildings, and with the city planners in the municipality, they started to build new how can I say, new set of buildings with the government, with the financial helps. So some of them have already been finished, and they are moving in at the moment. For the other long-term actions, we have started to create a building stock for the whole city. We started for the Bayraklı town in center, which had the most earthquake impact because of the ground, because of the soil type. So we finished 33,000 of building investigation. The number is for all of the neighborhood, all the buildings. And we created some building identification panels, and it includes for the citizens, for the living people, where to go in case of an earthquake or any natural hazard, and what should they do, what is the current situation for the building. It is severely damaged or slightly damaged or non-damaged or new, and the construction code for the earthquake, it is new or old. Then we completed and we started to work on the second one. In 2 or 3 years, it will be completed for the whole city, for all the neighborhoods in Izmir. And at the meantime, we started to observe the fault lines, which is in sea or in the land, in a radius of 100 kilometers from the city center, and also macrozoning works with the geology engineers. We started to obtain the all soil type and which are the critical or exposed to earthquakes, damage to earthquake effects. So these are the main long-term actions we have made. Also, these are made with a scientific agency, and we make the decisions with the universities together in order to make it feasible and safe and more fast and usable way.
Thank you, Mr. Hassan. So I was wondering, I mean, following the earthquake, I mean, there were spots that were, or locations that were identified as most sensitive, and they actually, it affected future planning, or it affects now future planning or future building.
Yes, of course. After the earthquake, actually before the earthquake, 3 months before the earthquake, our department has been founded for the earthquakes and this kind of research for the city to become more resilient. Then, when we have the earthquake, after 3 months, the government and the municipality, the president, also takes an important role for the earthquake and natural hazards in the city. So we become more fast to finish all the projects, all the precautions for the city.
Mm-hmm. And when you mentioned you mentioned also the building code. Was it coordinated with the national government? Is that a national code, building code for earthquakes?
Yes. It is national and valid for the whole Turkey. It includes the soil types, earthquake analysis methods, and some kind of important ways to implement earthquake effect on the buildings.
Thank you. Okay, thanks a lot, Mr. Hassan. I see that somebody raised hand and no more question, but we will get back to today's letter after we have at least one round so we can introduce all the speakers. But thank you, this is a very interesting experience to be shared with other participants. From Tunisia, we have from the Ministry of Equipment, Housing and Territorial Development, Mrs. Nadia Trabelsi. She's the Director General of Air and Maritime Services. Good morning, Nadia. I guess you're there. You can turn your camera if possible. Our question. Thank you. I'm sorry.
Merci. Bonjour tout le monde.
Yes, thank you. Good morning, everyone.
Good morning.
My camera is not working.
Okay.
I'm sorry for this. I have
This is
some troubles with my camera, unfortunately, but I hope that the mic is okay, because I think the microphone is the most important thing.
That's right. Thank you, Nadia. So that's all right. We'll understand that. I will introduce the first question for all participants that do not speak either English or French. Please notice the translation channel, and you can turn into the channel that's appropriate for you. Nadia, I will pass the question in English. You feel free to answer in English or in French. So the first question for you is, Tunis has been subject to various flooding episodes over the last decades. What are the main vulnerabilities of Tunis, especially noting climate change challenges? And what are the related threats to urban functions, environmental conditions, and adequate water supply?
Merci pour cette question.
Well, thank you for this question. As you know, Tunisia is a country that depends on water resources as the majority of the countries in the world. So the water issue is crucial. We are hit by climate change, and we have several programs to struggle against climate change. So within our strategy, that depends on the Direction Générale des Services Aériens et Maritimes, the Aerial and Maritime Services, the organism which is in charge of the works for the protection of the coastline, the preservation of harbors, the water rise is already calculated in our works. To come back to the question, there is a natural exutory of rain waters in a basin of 450 kilometers squares, and the waters go to the lake. And indeed, this lake, which is in the center of the city, of the capital, and the natural exutory of waters has been reflected within this valorization and planning to receive waters. We even counted waters from this release. If you want me to give you more details, I think the Sijumi Lake is considered as an urban area downtown with all the problems that the capital went through with these floods, because climate change means more important intensities, waters that go to this area.
Thank you, Nadia. if you can also elaborate on further on what urban planning and water management interventions have been planned or also already implemented in order to reduce the risk of floodings and also the magnitude of the flood impacts on the environmental conditions, public services, and infrastructures. So what else is being planned to reduce risk?
Merci. Donc,
Yes, thank you. So Tunisia lived in 2013 some floods in the capital, very important floods. And after this, there was a very important survey at the protection level against the floods of the western area of Tunisia, because the Sijoun Lake and its surroundings, it's the western part of the country. Many actions were undertaken because the lake is the receptor, mean they are the contribution of wet Niena, wet Hera, and they are about 49 rain water streams that go into the lake, and many actions were undertaken. I can mention the project that's the recalibration of Duat Triena between Duat to get to the lake. This is a first operation which was done as for the recalculation of Duat Triena. In the southern part, there is an ongoing work almost finished. This is the Versoir, which is the level plus 873. This is a spillway. Once we get a certain level, this spills through a channel getting to Westmelier, because in Sijumi, it was connected to the sea via a channel. With the planning and urbanization works, this channel has collapsed or is too full, and we cannot manage the excess of floods of waters. And amongst the actions, this work of vidange, this work of emptying, of draining, is coming to an end. All these works were not enough before, because the level of La Cetra has risen due to the sediments from wets getting to Asepra. So there was bathymetric works of Asepra to show that the level has risen. There were several actions of tremblement, of filament. That means 3,000 hectares of surface and 2,900. The ASEPRA cannot receive the 40 millions of cubic meters demanded by the survey, which was done against the floods of the PTE from the western area. So the planning for the planning and the valorization of ASEPRA, some works had to be done. We consider then the waters, these streaming waters, the ASEPRA, that should accept a quantity of 40,000 cubic meters with works that will allow to evacuate beyond this 7 or 8 level. And we planned within this survey, we programmed to undertake some excavation operations of SEPRA to allow this capacity of this water retention capacity.
Thank you, Nadia, for this for sharing this information. So it's not only that extreme weather events are causing huge damage and making us more vulnerable, but it's on the other hand is that it requires us to build infrastructure in a more resilient way. So it's a different way of looking into future infrastructures and to see how we can build them so they can fit the challenges of the 21st centuries. I'd like to, if you can stay with us, I will come back to you, but I'd like to move now to Mr. Luis Carvalho, head of Civil Protection Department from Amadora, Portugal, who is, the city is also a member of the Making Cities Resilient 2030 campaign. And what I'd like to ask you is about Amadora. Amadora has been the highest, with the highest population density of all municipalities in Portugal, if I'm not mistaken. This is indicating that any urban disasters or extreme situation has the potential of huge impact on population's health, as any service failure or disruption will affect a lot of citizens. And my question is, what are the specific vulnerabilities of Amadora, and how have the urban emergencies affected the population in terms of environmental risk, provision of critical public services and health outcomes?
Well, can you hear me?
Yes, we can.
Okay, thank you. Well, first of all, thank you very much for the invitation and the opportunity to share our experience. Well, in fact, over the last 20 years, Amadora major disaster risks have been flash floods in the urban area, urban fires, industrial fires, landslides, storms. And when we're talking about storms, we're talking about fallen trees, damaged buildings, infrastructures, and road accidents. So this is our major risks that we have in our city. As a highly urbanized territory, Amadora face a number of challenges. As you told, Amadora is one of the highest city that have the density population. And that means that we have a lot of challenge, including grow urban population and increase density, the decline of ecosystems due to human activities, and the adverse effects of climate change. And well, in a city with 24 square kilometers and almost 200,000 inhabitants, managing risks is a constant challenge. For example, managing the COVID-19 pandemic in this context in our city profile was indeed challenging. For looking for our city risk metrics, we have several vulnerabilities. The first one is the increased percentage of elderly population. Amadora, actually, we have almost 20% of our population that have more than 65 years old. Secondly, we have high pressure on the emergency service and the limitation of human and technical resources in the safety and health structures. And finally, we find in our city some population living and with few financial resources. For example, in recent years, the emergency that affected the city population affected differently. We have more than 40 emergencies per day. And if I can give you a practical example, it's clear for us that when we have a specific emergency like urban fires, this kind of disaster or emergency affects people in a different way. For example, we have in the urban fires, people with lack of insurance, prevention measures and mechanisms, and is differently the response capacity and conditions for recovery. And we see that these conditions are less better in population that have few resources. And the COVID-19 pandemic also affected our population in different way. Population with few resources had more difficulty to manage the financial and social impact that the pandemic brought us. This forced the city, for example, to create several mechanisms to support the most vulnerable populations. And that revealed again a set of additional vulnerabilities that we find in our municipality. Lack of information about risks in the municipality, we see some of them. And for example, about the pandemic situation, we didn't have any information on the field about this, and the lack of a mentality for prevention in the community. And in the other side, we saw some things that was very critical for us. We saw difficulties for the rescue, health, and safe entities about the sufficient resources to guarantee the response to recovery and to restoring the normality. Again, the COVID-19 pandemic showed us some impacts and distresses. For example, the difficulty that we have to monitoring and comply measures, the sharing information between entities, health, rescue, security, social, geographic information systems, the capacity that we have to get the COVID equipment, physical and mental tiredness about the COVID teams, and the intervention strategy that we have with constant change. So that means that, for example, for the population, we have a lot of difficulties to manage risks, and sometimes it's important to say that. And we have some difficulties just to guarantee all the resources that Amadora needs to response to and to recovery. The climate change risk in another way is a practical example. We have some difficulties there just to guarantee to the population all the measures that we need in the mitigation and adaptation phases. So that means, for example, that we have a lot of challenges about how emergency affected the population, because we have limited resources in rescue and health structures. And sometimes for us, it's not very easy to communicate the risks and guarantee all the conditions that we need to a safe and recovery strategy for all our city.
Well, thanks, Luis, for sharing that with us and being very open about, the increasing challenges on one hand and the limited resources on the other hand. And my next question to you, how do you bring the public and other stakeholders like the private sectors to be more involved, to be to build with them urban resiliency strategies and contingency plans? I mean, how do you make them more part of the solution?
Well, on this way, I think the Making Cities campaign about United Nations was very useful for us. We, in 2010, when we joined the campaign, we had a lot of challenges in place, and we have a lot of challenges right now again. But the campaign was, the United Nations campaign was very useful just to give us the guidelines to how to work with stakeholders for emergencies, for disasters. That was very critical for us, because bring us a fresh approach to how to build more resilient community. And when we joined the campaign, it was very interesting, because we go to the stakeholders to show them how important it is to have a network with stakeholders, and how it's important to have this perception from them, how we too have to improve the resilience at the local level. So it was very important just to organize meetings, have some indicators to look at for them. Was very interesting just how to always important to sharing data. And we established during the last decades and relationship between input and output with stakeholders. For example, when we did data just to organize a plan for health or for emergency procedures, we have this relationship with them. So for example, all the information that we collect from the stakeholders, we provide to the population. And I give a practical example. COVID was very intense challenge. And as I told you, in the beginning we faced a lot of problems about sharing information, about how to communicate risks to the community. And the solution was just, again, to sit down to understand where is our gaps about the data sharing. We establish a network, we establish a methodology, how to collect the information and how to provide the information to the public. Right now, for example, we put a lot of information on the social networks. We bring for this solution about network stakeholders, bring some private sector. We don't have all the private sector with us, for example, about insurance companies, banks, because it's important for us to understand the impacts and the costs of the emergency and disasters. It's not easy to get information, to sit with them, to explain that we need the data and we need to convert data or security data to public data. So we know that's not very easy, but our approach is we have to communicate with our community in a simply way, just to give them the capacity to prevent better the emergency and disasters. I think that's the point. It's important for all to explain to all the stakeholders, for the public, for the private, that the data that we need is just to communicate better the risks. Otherwise, we don't get any solution to our best parts at local level, that is the population. So, and we know that the last 5 years, we start working with some insurance company. They give us just the general data about the costs and the impacts that we have about the emergencies. For example, understands the impact of the floods, how many costs for the municipality this flood. It's important for us just to know the general cost. For us, this is the first beginning. Have this data just to understand and have a capacity to understand our historical loss data. So what were the costs about it? And that means that we can just do better in the next time. And that happens with COVID, just to understand the impact and the numbers about the employment, how many, for example, shopping centers that are closed, how many costs that involved. So we know that is the bigger challenge, is just to bring the private sector. We are working, for example, with shopping centers, practical example. With these shopping centers, we, for example, deliver some information just to, they provide when we have the forest fires or the heat waves. They measure the information and put information on screens on shopping centers about the prevention measures that we need to the public understand and see when they are shopping. So this is kind of a relationship that we have to establish, and we have, for example, information and awareness program for the community. And this information and awareness program that we have for the community is a program that we have a lot of entities that provide sessions, free sessions about disasters, about emergencies. In this program, we have, for example, the health local authority. And that means it's important. I think the solution is all the time the networking with a lot of partners, because we need the data, we need them just to prevent, to the rescue and to the recovery better. So that's this is our experience. We know, as I told you, we have a lot of work to do because we have a lot of challenge. But I think it's step by step, maybe show to all the stakeholders that we have the benefits, because it's not just about my side or your side, it's about the community side. And if everyone understands that, I think we could have better results for sure.
Thank you, Luis. Wonderful and interesting, experience that you shared with us. And pretty much confirms many of the key messages that were presented earlier also by Matthias about the data collection, especially data related to the risk. But I definitely agree, quantifying the data as much as possible, also the economic aspects. so we can contribute more in return to the community on when it comes to health and environment. It's really, really critical. And also the participating planning and the engagement with the community is very important. So with that, I'd like to move just next to you to Spain, to Caroline Dar. She's a program director at the International Society for Urban Health, and also a coordinator of the Urban Planning, Environment and Health Initiative at IS Global in Barcelona, the Barcelona Institute for Global Health. Good morning, Caroline. Caroline and also colleagues from IS Global were involved in the WHO Urban Resilience Project and also prepared two of the technical report, as also mentioned by Matthias, and thanks again for that. So my first question to you, Caroline, is cities and urban areas increasingly recognize their vulnerabilities to disasters and extreme conditions and aim towards increased preparedness and resilience. We also have heard this morning from 3 locations what the potential impact on urban life and urban health can be. How do these examples match with the overall evidence on environment and health impacts of urban disasters?
Good morning. It's a pleasure to be here with everyone. I'm sorry I have a bit of a cold, so my voice is a bit strange. Thank you. Yes, it was really interesting to hear the city examples. I think when it comes to the overall impacts, one of the things that I didn't hear mentioned today was not only the physical, but the mental health impacts of disasters and preparedness. And I think that that's something that's really underestimated, but we've seen with the pandemic has become more important and more prominent in the public discourse. A lot of people post the COVID pandemic are experiencing anxiety, loneliness, and other symptoms. So I think when we talk about health and the health impacts, it's important to understand that we're not only talking about illness or death related to physical impacts of a disaster, but that we're also talking about social and mental health impacts. So I think that perhaps a greater emphasis could be placed on those. In terms of some of the other health impacts, we know that heat is the natural disaster that kills most people worldwide every year. And with climate change, that is set to increase. Flooding also can have a lot of impacts, not only in the immediate, in terms of injury and death in the immediate instance of the flood, but then the infrastructure damage that it can do and the creation of these kind of cascading effects related to fires or the interruptions of basic services that would disproportionately affect local populations. I was glad that the word equity came up, because I think that's one of the other main points that we would want to address in this. Really, most like any other instance, when we think about the impacts and the health impacts of disasters, there are certain populations, usually vulnerable populations, which are going to be much more affected than others. And equity is a word that's increasingly, like sustainability, used in the discourse, but I think that it's used in many different ways and not always attached to a consolidated set of efforts to really address equity and equity impacts. For instance, you know, I think when we talk about equity, we're talking about the distribution of risks and benefits. But there's also, as we can see in the results of natural disasters, not only the immediate impacts, but the result of kind of these structural inequities that are built into a lot of these societies, and the participatory inequities about who is represented in disaster planning or in communication and take into account in terms of data. You know, a lot of informal settlements or vulnerable populations, as Matthias was pointing out, are not properly considered. And so equity kind of has many of these different facets. And at the International Society of Public Health, we've embarked upon a project that is trying to look more specifically and unpack how equity can be related to kind of planning and development to make cities more resilient and sustainable. And I'll put a link to that project later. But I think those are some of the aspects. And then, you know, again, when we talk about disasters, we're a lot, I think, focused on these immediate crises, but there are other, I would say, public health epidemics or disasters that we're facing, like the impacts of air pollution, which we know leads to 7 million deaths worldwide, overweight and lack of physical activity. And these are much all, as with the impacts of a kind of an acute natural disaster, really tied to the way that our cities are planned and managed. And so with the onset of climate change and the kind of the frequencies of these events and the cascading multiple hazards that we're seeing, I think now more than ever, we have an imperative to understand that cities are very complex, that a lot of these factors have similar origins and need kind of a greater, more scenario-wise thinking and all hazards approach when it comes to planning for the future, because I think there is kind of a consensus on what we need to do and the kind of responses we need to have in terms of the technical response. There's a lot of strength there in local city knowledge. Usually there are people prepared within the cities that know what to do, but a lot of our administrative processes and the how we're going to achieve what we need to achieve is kind of where the weak link really can come. For instance, we see that unlike many other competencies, the competency for health normally is at the national level and not at the local level. And that can create real challenges when we are trying to have a disaster response and disaster planning, because both the budgets and the planning and the guidelines aren't responsive to the local context, so there's not local authority. So I think Matthias pointed out these three different areas. I think the administrative, the how we do things in these processes really needs a lot more attention. And I think again, that health isn't necessarily explicitly embedded in a lot of these disaster management planning scenarios. There's a disconnect between the different agencies. And so there can be real strength, perhaps in land management or certain types of responses, emergency services, but it's disconnected in many ways with the health sector and public health planning. I think with heat is where we see that there's the most connection with the health department because of the acute relationship that's very quite visible. And I think there's a lot of improvement to make climate change and to make disaster preparedness really more explicitly tied to health, especially when we're talking about how cities can build urban resilience and develop urban models that foster health across the board in an everyday way that then also contributes to resilience.
Oh, thank you, Caroline. You really covered a lot, I mean, a few messages that I hear is, first of all, is really how to connect the local and the national, because some of the solutions are at the local levels, obviously. I mean, therefore, we have to involve the local level. If you want to have a solution, to create a solution for physical activities and more mobility, more walk, it's in the city, it's in the hands of the city, the planning, etc. So the local and the national must be connected. And the other thing is, there is a real, we need to approach this situation, the health and the environment issues in a dual track way, kind of. There's extreme events that we need to respond to disasters or epidemics or etc. This is one thing, but there is also ongoing risks. Air pollution is still with us. Obesity is still with us. And those are also kind of pandemics that we need to, and ongoing pandemics that we need to take care of. So those are the immediate response and the long-term response and the ongoing response. They all have to be connected. And I want to ask you to take another question. We heard previously local examples, and we saw a variety of urban planning and management approaches to make cities more resilient and also better to be better prepared for crisis. And my question is, what general trends and priorities do you see in the area of urban resilience? And to what extent can international preparedness and resilience frameworks and commitments support action at local level? If you can mention several of them.
Yes, well, I wanted to point out that actually just recently, Cornell University conducted and released what they call the Global Survey of City Leaders. And this is an unprecedented report that surveyed 241 city leaders worldwide to kind of identify the trends in thinking and about what's on city leaders' minds. And some of the things that came out from the survey, again, is the importance of mental health impacts of disasters, but then also the recognition about climate change being high on the agenda and the need, for instance, to change the mobility and urban kind of model paradigm. So most mayors agree that they need to have models of mobility that are focused more on sustainable transport and encourage walking and cycling. And yet we know that that is actually incredibly difficult, and there's not enough implementation of policies that really reduce private vehicle use. This is going very slowly, despite the very clear impacts on multiple fronts that this has, including with disaster management, because a city based on a private vehicle motorized transport with a dispersed model is not going to be as resilient to a number of public health threats. So I think that that this survey is very interesting to identify some of the trends that are out there. I think also the trends, as was pointed out in some of the city responses, the need to harness local community networks and capacity. There is a lot of community capacity to be resilient. People are resilient, communities can be resilient. And so instead of duplicating efforts, it's worth investing in investigating and tapping into and connecting with these local resources that people have to engage citizens and to participate with them in building this resilience. And a lot of that can be tied also to data collection and sharing. So it was encouraging to see that and here's some examples of that today. I think in terms of international frameworks, there are, as the report points out, a number. The Sendai framework for disaster risk reduction is a very good framework. There's been a lot of intentional thought by experts on this. The problem that we're seeing is that these don't get localized down into the city level. And I think that merits some more thought and investigation of how we can bring these global level frameworks and these global level resources more locally, because they don't make it into local planning. And cities also don't have good mechanisms to learn from each other. There are lots of cities in the world that experience floods, and they learn from these experiences and they can build from these experiences. And so how do we get cities to interact and share this knowledge and be more proactive? So I think, in terms of the way forward, we need structural or systemic transformation based on this all hazards and multi-risk approach that can use these international frameworks that exist to try and localize them more and embed into their policies and action and find the local indicators that they need to use, and to really look at the tools that are out there. Again, a number exist to how to integrate health protection considerations into mainstream urban planning and health management. Urban designers, urban planners, transport planners, city managers are all public health agents, and the urban model is a public health intervention. And I think the more that we can recognize that and build health into all policies, we'll see that contributes to city resilience overall, to kind of address some of these longer term disasters that we have, such as air pollution or loneliness, and also the more acute ones that could be related to climate and weather and natural events.
Thanks, Caroline, for this interesting intervention. What I hear in my mind is like breaking the silos, among different units, among different government levels, among different international interventions. Everything is linked to everything, and using a multi-risk approach, and also trying to process the information, the data, and eventually to try to influence at all policies is also very critical. But we also heard about the limits of limitation in resources that many cities have, and that may continue to be a challenge. And the focus need to be able to see how we can support it is to become healthier, more resilient, and more sustainable. You mentioned the Sendai International Framework. Obviously, there are additional, probably because of time, we didn't have time to go into that, but the SDG, the Sustainable Development Goals, is another framework that can be used as indicators for cities. Also, the Paris Agreement is another tool that does not only affect at the national level, but also cities can join and try to see how they can reduce carbon, etc. So there are lots of initiatives that cities need to be connected, and this is also a challenge to see how they can set the priorities within the cities, because all cities are not necessarily alike, and each city has its own risks. I was wondering, Dr. Rakesh Kumar Mishra, you are intervening in the chat. Would you like to be given the microphone to speak? Is there any intervention that you'd like to make? Maybe I can ask the IT support if they can, because I saw your hand has been raised. Because we do read your comments in the chat about coordination at the local, at the government, and the national government, reduce cost of disasters. And you're asking how to make urban city more resilient about climate change. We heard some of it today. What are the urban indicators? Would you like to intervene, Mr. Rakesh Kumar?
Yes.
Yeah, go ahead.
Madam, the given point that cities make more resilient toward new challenges such as the air quality pollution, air pollution, wastewater management, and river cleanliness in their city, and we make more forestation at make a resilient toward climate change.
Thank you.
Hello?
Yeah, we can hear you. I can ask any of our speakers. I'm sorry, either from Portugal or from Tunisia or from. Can you hear me? Yeah.
Yeah. Okay.
Okay. So I'm asking our now participants from Izmir or from Tunisia or from Portugal, if they want to take your questions about, dealing with ongoing environmental challenges in the cities, air pollution, water, climate. Is anyone, either Mr. Arsalan or Nadia or Luis, are you?
Yes, I can just share our experience about the indicators, because sometimes it's important to have a profile for the city, and we did, for example, the scorecard, a tool that is available about the United Nations, the Making City Resilient campaign. We have available a disaster scorecard where we have a lot of indicators that we can just put information and understand with our level of commitment. And yes, I think it's important just to have all the to understand all the needs that we have about the water, about the electricity, because we have a lot of challenge on this way, about the crisis that we are in. And I think the most important, I think, in the first step is trying to understand if we have information just to delivery some issues and some strategic matters. Because sometimes the most critical is the information that we are available just to build our strategy about, for example, climate change. On this stage at local level, for example, in Amadora, we are just collecting all the information that we have about the temperatures, about the structures that we have for our water, electricity, just to understand if we have all the capacity that we need to face all the challenge that are in place about climate change. I think it's sometimes have the information that we need, the indicators, understand them, the dynamic in all the way about this issue. For example, we did a study about what was the climate in Amador in the last 3 decades. We have more high temperatures, you don't have more high temperatures, we have the increase or decrease participation. So it's important to understand these dynamics just to dimension all the structures that we need to give an approach about adaptation or mitigation for climate change.
Thank you very much, Luis. So we have a question in the chat from the EEA, the European Environmental Agency, especially to Caroline. Caroline, if we can bring you on board here. It reads, long before the policy and the implementation, do the cities have enough data to analyze and measure accurate status of accessibility, especially for the transformation needs of modes for transport, for integration of biking and walking to the public transport, for measuring the level of capacity needs to transition to electricity? Would you like to address that?
Sure, I was answering it in the chat, but I'll answer it here as well. And I think that that's a great question that often comes up. Having good data, not just at the city level, but also at the neighborhood level is key, right? Because we know, especially for equity, you can see vast differences from neighborhood to neighborhood and sometimes even from street to street. However, for many mid-size and smaller cities, data availability remains a critical challenge. There isn't the capacity or the investment in data collection for the number of indicators that we need. And so this is something that I think really needs better attention in the future. But paradoxically, we see within the health sector, but also government in general, it's hard to get proper investment in prevention. We spend a lot of money reacting to illness, reacting to disasters, when it would be much more efficient in cost and otherwise to prevent. And yet over and over again, we see that we aren't willing to make sustained investments in prevention. And I think we need a real paradigm shift on this. And this is a pattern that repeats itself over and over again. So yes, we do need better data. Cities need to invest in that. They need, I think, to request national support to do that. I think this is where citizen science and citizen involvement can also increasingly become relevant and key. There are now today a number of low-cost ways and sensors and technologies available for citizens and communities to give data about their local exposures and responses. And we heard a few of them, especially from Portugal, about how through social media or otherwise. So I think technology is on our side here, that we can implement these measures and put in these systems and involve affected groups, tap into these local networks to get the data that we need. Then that requires data management, which is a whole issue in of itself, because we have an overabundance of data, and making sense of it all and making sure that it's useful is another challenge. But I think that there's hope there, and certainly it's something we need to pay more attention to.
Sure, data verification will be also part of this management, obviously, but yeah, we need to be careful on one hand not to have that, either marginal data or too much data or inaccurate data, but on the other hand, data coming from the field, from citizens, is also very critical. And yes, definitely, I mean, to have this information beforehand is better to prevent disasters, to prevent or to better prepare. I was wondering, there was a hand raised by the embassy, Algerian embassy in Brussels before. Are you interested in taking the microphone? The embassy of Algeria in Brussels. If so, go ahead.
Je veux remercier Madame la modératrice.
Yes, I want to thank the chairwoman. I talk from Brussels, and I'm in charge of regional cooperation with the UfM, together with the co-presidency here in Brussels. I want to thank the reporters for the quality of their reports, talking about the reinforcement of fair living mode, in particular after the COVID-19 pandemic. I want to come back on the first presentation elaborated by Bouanes. As you know, Algeria is a Southern European country. We are members of the UfM, and to which measure these reports as well as the streaming messages. So all the countries of the neighborhood, we will be part of this. We heard with much interest these experiences of resilience of Turkey and Tunisia. For the Western Mediterranean countries, as well as the preoccupation. So how can we put these key elements dedicated to the region can be of profit to other neighboring countries, in particular to Algeria, as for urban resilience? And secondly, there are also disparities as for the context and capacity between the member states, the southern and northern countries. We're talking of a key partner of the Union for the Mediterranean. How can we contribute to fill the gap between the two banks so we can preserve environment and health? My third question, which will be the operating conclusions after this meeting, which is crucial in the works for the urban development, taking into account that this will coincide to the next ministerial of the UfM on urban development. To conclude, I want to know, as for the perspectives, what will be brought on the financial and technical aspects as for neighborhood in southern countries, taking into account their capacities of urban resilience, if we take into account the risk management of catastrophes and the inherent risk. Thank you very much, and sorry maybe for the translation, this was a bit fast and the sound was not as accurate as we would have liked to.
Well, thank you, Mr. Batoba, for the intervention. I think that I would leave the answer to Victoria after we just have a very quick round of the key messages from the participants, because we are running. We already passed the time that allotted to this session. So I want to go back to Nadia, to Luis, and to Yukan. Okay. So Tunis, Izmir, and Amadora. I'll go with by this order, and then Caroline. I'd like you to maybe to summarize with one key message that you may want to leave us with on any of the aspects of your work that relates to this conversation, this session. So I'd like to start with Nadia. Nadia, do we have you with us? Okay, I think perhaps Nadia's line dropped. Is it possible? So I'll go to Izmir. Yukan, would you like to deliver your final key message?
Yes, I would like to say something special for the earthquakes, mostly. For the earthquake-prone cities, it must needed to be prepared before the earthquake by all means. You understand? You just first prepare the basic precautions before the event, before the disaster. Then you will have event from the disaster. This is the main prevent a natural disaster in a resilient city.
Thank you so much. Thank you, Yukan. Luis, one last message coming from you.
Well, thank you. Very quickly. I think just two small notes. The first one, that the importance of local work and local action in cities, I think, is essential for disaster risk reduction. The first level of resilience intervention is in local communities. So in prevention, rescue, and recovery. So if we have resilient cities, we have resilient countries. And finally, I think the solution that we want and what we need to achieve urban resilience and so on is networking with local stakeholders, local governments with national governments, and national governments with international agencies. So I think this is the solution that we need to be better prepared for the future. Thank you.
Thank you so much, Luis. Caroline, last key message from you.
Thank you again for the opportunity to participate. I would say, yes, cities are key. They are the key to so much of this. So be optimistic, be ambitious, be brave, and work on connections. Connect with your communities, connect with each other, and connect with your national governments to really lobby for the resources and competencies that you need.
Thank you, Caroline, for those suggestions, and also for your ongoing support in the work that we do here at WHO. With that, I'd like to thank to the speakers, and I'm so sorry we lost Nadia, but it was a very interesting session, and thank you so much for your contribution. And with that, I'd like to give the microphone to Victoria to summarize and maybe to respond also to the comments by the embassy from Brussels. Victoria?
Thank you. Thank you, Sinaya. Perhaps I can do both things at the same time. For us at the UfM, urban health has become an important topic that we aim to deep further in the coming years. As a result of the 3 webinars that we have already jointly organized, we would like to draft a short leaflet with the main results of each one of the webinars and distribute this information among our national coordinators as the result of the work done. But in any case, it's true, as Afef mentioned, that we are in the run-up of the 3rd UfM ministerial. We would like to make sure that urban health is one of the topics to be addressed in the coming years within our working groups of urban transformation and urban housing. We have seen today that, for instance, data collection and apply this data collection related to risk in land use planning, for instance, is a key topic, and we would like to see how we can work on this with WHO and perhaps with IS Global also, if we find the way to do that. So that's one of our priorities. We are fully aware that the WHO Regional Office for Europe works mainly for EU and some other countries, but not for MENA countries. But we are trying to use the platform that the UfM provides, gathering 42 member states to spread the conclusions and the main results of the work that Sinaya is doing. But in any case, we will try to concretize this more and try to work on concrete projects in the coming year as far as possible. And basically, I give back the floor to you, Sinaya, to conclude the session from our side, because we are very late.
Thanks, Victoria. Thanks again, first of all, to the speakers and also to Matthias that presented the summary of the work, which you are welcome to read. It. The link was for the 4 reports was shared through the chat. You are welcome to send us comments, as was suggested. Thank you also for the interpreters for doing a very good job interpreting, and for the IT system that is behind. So thank you so much for that. Thank you for Union for the Mediterranean for this ongoing collaboration. It's our 4th webinar on urban issues, and I hope that we will continue. The work on sustainable and resilient and healthy cities is an ongoing work. There are lots of challenges. In addition to that, we are also dealing now with economic crisis, with the energy crisis. So there are just more and more challenges coming up at the national level and the urban level. And I think that the key messages coming from today about the data, about the need to analyze data that relates to risk, the participation, the participatory planning with the communities, the transparency, the engagement, coordination with the various government bodies, a whole government approach, a multi-risk approach, whole policies is an ongoing thing. When we design land and plan land use, I need to make sure that we keep buffer zones, that we are avoiding a cascading effects. And this can only happen when we have the data and we have the good analysis on a multi-risk approach, etc. And also making sure that we have cities that are pleasant to live in and healthy and resilient and sustainable, also giving the ongoing environmental challenges that we have, the need to solve inequality issues, to have access to green space, to take care of issues related to mobility, noise, air pollution, etc., water issues, climate. So the challenges are enormous, and I hope that together with the great people that we have all across the region, we should be able to solve that. So thank you so much for being with us today, and regards from Bonn and Barcelona. Goodbye.